There's actually three of us, Dr. Chapman and Dr. Cook, and then me, and then I have our lovely support team, our PA, Tina, and then Amanda. These are really our front line when it comes to urology. And so you could think of them as an extension of us urologists. So if they're telling you, hey, there's a lab that needs to be done, or if you have any question, you can know that if they have answered it, they have either talked to us directly or they already know the knowledge to be able to answer you directly. So Amanda and Tina are wonderful. So this is going to be a very casual conversation, nothing formal. Basically, if you do have any questions, feel free to even shout it out or raise your hands. But basically, what I'm really going to talk about is just prostate cancer, the prostate in general, and then your health relating to that. So the first we can start off is the prostate. What is it and why it's important? So the prostate is a gland, or you can think of it as an organ, that is at the bottom of your pelvis. And so the purpose of the prostate that we mainly know of is it's a sexual function. And so it actually provides lubricant for the sperm to come through and then go through the channel and allow you to impregnate a person. The prostate is on average smaller than 20 grams. That's the normal size of a prostate. So you could think of it as a walnut, the size of a walnut. So men, though, as you know, your prostate is always growing. So your prostate can become enlarged, and that's where some men may start to have some urinary symptoms. So these symptoms can be something as simple as a slow stream, having to push when they're going to the bathroom, or they can notice that their stream stops, or even at some point they can have blood in their urine. And so these are all symptoms that should be prompting you to seek out evaluation or see a doctor. Sometimes your primary care doctor can easily feel comfortable to be able to treat you and start you on a medication. The medications that we currently have available for men are alpha blocker. The most common one that many patients may know of is called Flomax, or tamsulosin is the generic name. But basically, Flomax is a medication that tells the urethra, which is the channel for the urine to go through, it just tells it to open up as wide as it can. And so that's to help to allow for the urine to get out. And then the other type of medication is a PDE5 inhibitor, another fancy term that really you don't need to really worry about. But basically, that medication just shrinks the prostate, particularly the excess tissue that is causing blockage for the urine to come out. And so by having the PDE5 inhibitor on board, as well as the Flomax or the alpha 5 or the alpha blocker, the combination of those two medications has been shown to help men to not have to progress to surgery. That being said, just because you're on the medication doesn't mean that's the only way we can treat it. There are surgical treatments that we have. And so if you're someone who does not want to be on medication, then that is where we offer patient surgery. Now, just because you have an enlarged prostate, we do worry about prostate cancer. So currently, the main standard of evaluating for prostate cancer is the PSA. So this is a chemical that is released from your prostate as your prostate either gets larger, it can release more PSA, or if your prostate has some swelling, that could also allow or cause for the PSA to be elevated. Then If there's an infection, that's also another sign as why the PSA can be elevated. And then the last is the prostate cancer. So when we see an elevation in the PSA, we don't automatically think prostate cancer. We kind of start to talk, we hear your history, and then we start to figure out, based off of your history, the most likelihood for why the PSA is elevated. And so now we actually have some additional tools that helps us to clue us in if it is prostate cancer or if it's something else. The MRI actually has been shown to give us more information on how big the prostate is, but also it shows us if there's a nodule or something that looks weird in the prostate that would make us think like, oh, maybe there might be some prostate cancer. So luckily for us here at Astera, we are actually been working on getting prostate MRIs available for men. So that should be something that will be available for not just us urologists, but actually your primary care doctor can order the prostate MRI. Adding on the MRI for the prostate, there's also these newer, what we refer to as biomarkers, so fancy term for another chemical, that we look and see if there's anything that can also clue us into prostate cancer. And so in combination with all these particular chemical and treatments and diagnostic tests, it allows us to know, like, does a person have the likelihood of having prostate cancer? And so the true way to diagnose prostate cancer is actually to do a biopsy. Now, a biopsy is not a benign thing. There are risks involved. Particularly, we worry about the risk of infection, particularly sepsis. So with the biopsy, we do different treatments. So we can give you certain antibiotics or have patients do an enema, but there's still that risk of infection. And so when we are telling someone that they need a biopsy, trust that we have evaluated this and we have not taken it lightly. And so once somebody is diagnosed with prostate cancer, then that's where we kind of look about the different treatments. So depending on the type of prostate cancer, you can think of it as 3 treatments. So one, active surveillance. So this is where we're just monitoring patients. And that we usually see for more of the low-grade prostate cancer. But if there is intermediate or high-risk prostate cancer, so the likelihood of it spreading outside of the prostate, then that's when we're more likely to offer a definitive treatment. And the definitive treatments are either radiation or surgery. And so for my patients, I tell my patients, right now the equivalence of surgery versus radiation, they're equal. So either way that you decide to do, the survival of doing the therapy with either surgery or with radiation, we know it's equal. So it's all about the quality of life. Now, prostate cancer is a slow-growing cancer, so ultimately you want to have a quality of life and you want it to be good. So maybe depending on your other conditions or your kind of life that you're living, we may even tell you, yeah, maybe you don't need to do anything. Maybe we just kind of let this go and focus on other stuff. So there's a multitude of things when it comes to the prostate, but it's very important for you to be aware that prostate health is important and that you should talk to your doctor, but also talk to your friends about it, because they may think that they're the only ones experiencing this. And so by you actually having a little bit of knowledge from, I'm hoping from this little talk, that you can also talk with them about how they need to actually come in, get evaluated, and it's okay to see us urologists. I like to leave before I end it and open it up to the floor. I like to say your urologist is your friend and your foe. Um, friend because like there's many times, you know, we get to laugh and chat about things, but the faux part is like some of the stuff that we end up having to do. Many men don't like it, so that's the friend and foe part, but we're here to help you.